Hello, hi everyone. This is Margaret McDonnell. I'm the Executive Director of the United to Beat Malaria campaign at the UN Foundation, and we are live here in New York City during UN General Assembly Week here at Idealist headquarters. Really excited. Thank you so much for joining us today. We're going to have a really fascinating conversation about, drum roll, dun, 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 integrated mosquito management or outdoor mosquito control. I never thought I'd actually be excited about this conversation, but I am, and likely to be joined with some fascinating experts and panelists here today. We're joined here live with Manuel Lluberas, who is a public health entomologist, a senior consultant with Mosquito Den, and member of RBM's Vector Control Working Group. Also joined live by Dr. Silas, Majambere, a medical entomologist and business manager of Africa, Europe, and the Middle East for Valent BioSciences. And we're going to be joined, unfortunately, he wasn't able to join us in person, but we have video remarks. I'm very lucky to be joined by Dr. Godwin Ntadom, who is a public health expert and a malariologist and the national coordinator of the Nigerian Ministry of Health's National Malaria Elimination Program. So really excited to have this fantastic group of experts. And first, I'm gonna kind of kick off with a little bit of an overview and then turn to Dr. Lluberas and Dr. Majambere. Then we'll hear from Dr. Godwin. Then we hope to have at least 10 or 15 minutes for Q&A. So please do put your questions in the chat and we'll make sure to get to them at the end of this program. So let's dive in. So we all know, or those of us who care about malaria in the public health space know that we're at a really precarious inflection point. There's been tremendous progress against malaria, specifically over the last 15 to 20 years, yet we've significantly stalled. And everyone in the community, it's an exciting time in the sense that everyone in the community recognizes we need to be doing things smarter, more strategically, perhaps looking back at old strategies that were either moved on from or not fully embraced and over the last 2 decades, but also look at new ways of working together, multi-sectoral ways. How do we better invest in localization and working with, most importantly, making sure that endemic communities and countries are centered and prioritized. And so we know, it's actually interesting, here we are in the US, we know that in the US, how we eliminated malaria in 1951 was actually, in part, integrated mosquito management was very much a part of that helped us eliminate. That's actually why the CDC was created, right? Isn't that fascinating? But a lot of us don't, even people who work in sort of malaria and public health don't fully understand what integrated mosquito management means, what outdoor mosquito control means, and so we're gonna dive into that and really talk through what are the challenges, what are the opportunities, and how can it be an essential strategy looking forward as we all are committed to ending malaria. So with that, let's dive in. Okay, so for our time, let's jump into the conversation. Would love to hear first from you, Dr. Lluberas. So can you just start with a definition? What in the world is integrated mosquito management? And yeah, let's start there.
Forgive me for reading this because I don't want to forget the definition, but some 50 years ago, integrated vector management was defined as, quote, a rational decision-making process to determine the most appropriate mix of interventions, drawing from resources beyond health, both public and private, to bring about an effective degree of vector suppression. And what we're talking about in this mix of interventions is a lot of things. Among the things we have, and again, forgive me for reading this, but because it's a long list, it's larval source management, or reducing mosquito larvae where they are. Larviciding, which has the same effect, the application of biologicals or chemicals to the water to reduce that the larval population. Monomolecular oils, insect growth regulators, synthetically made hormones that affect only mosquitoes, ultra-low volume sprays, drones for aerial surveillance and spot application treatments, satellite imagery, and I would like to spend some time on the satellite imagery because that is a very fascinating topic, aerial spraying using fixed wing planes and helicopters, sterile insect techniques, and we can discuss that at length at some other time, lethal gene insertions into the mosquito population, the use of Wolbachia in mosquitoes, and several other strategies, and let us not forget what the community can do to make their surroundings less favorable to mosquito population production. All of those put together, and again, this is the rational decision-making process for the mix of interventions. What we do is figure out how these interventions mix together that bring about a control for a specific area, and in some cases, a specific mosquito.
Mm-hmm. Okay. So that sounds very comprehensive. So it's not just about outdoor mosquito control, but maybe Silas, could you speak specifically about the outdoor management piece of this puzzle?
Yeah, so thanks. So we're probably used, for those who are in mosquito control, specifically for malaria, I'm speaking from an African perspective, we're used to things that happen indoors, bed nets, indoor residual spraying. But a big part of what mosquitoes do is not just being indoors. So mosquitoes spend most of the life cycle outside before they get into the house. So what my colleague Manuel was talking about happens mostly outside. So when they are laying eggs, when they are resting, when they are flying to find the host, all that happens outside. So what we have been missing, particularly in Africa, is that part of the mosquito life cycle that happens outside that we are able to control, that has been able to, other countries have been able to control. So that's the part, perhaps when we talk about outdoor mosquito management, it's not to forget that indoors we're doing something, but it's to say what else can be done outside before the mosquito actually comes and attacks you inside.
Right, okay, so it's been that there's been such a focus on that the majority of malaria-carrying mosquitoes, at least up to this point, roughly, have largely bitten at night and indoors. So there's been this sort of perhaps overemphasis on the indoor management through tools, through innovation and commodities. But you're saying, right, it's still important to manage them outside because that's where they're breeding anyway and living. And
Correct.
now we also know that with the spread of Anopheles stevensii coming into the African continent, we know that they're outdoor biters, day biters, urban dwellers. So there feels like there's that much more of urgency around the importance of outdoor and an integrated approach. So we've gotten pretty weedsy already, but I want to pull back for a second because I know you're both known for being very passionate, rabble-rousers, maybe troublemakers. I like to think, as John Lewis, the civil rights activist, said, make good trouble. So, but could you explain, why are you so passionate? Why are you so passionate about this work?
I've been doing this, I've been chasing mosquitoes around the world for roughly 40 years. And if you ever get the opportunity to witness the direct effect of a mosquito-borne disease like malaria on a young child, it leaves a very long-lasting impression. And when it first happened to me in a refugee camp in Somalia, somewhere around 30-some years ago, 35 maybe years ago, I told myself I needed to do something before I could not do it anymore. And here I am, 40 years later, still doing and still arguing for that baby that died of malaria, complicated malaria with a few other things. And that image is still alive in my mind.
How about you, Silas?
Yeah, well, it's a hate relationship I have with malaria. So I've had
Not love-hate, just
no,
hate.
no, just
Okay.
hate. Absolutely hate, no love. So I've had several episodes of malaria in my childhood. I'm from Burundi, endemic country for malaria. And the thing I probably remember most is towards around July year is when you have the exams, like the end of year sessions at university or in secondary school. I've always finished my last exam almost every year sick. So being tired, mosquitoes around and all that. So it's something that I know personally. One personal story, I hope she doesn't mind, my sister. She once, so we're sitting in a living room and we're having lunch. She had a little bit of fever, so she went to sleep. So like a few minutes later, we hear someone talking in the room and we knew she was alone. And we kept hearing someone talking, but it was her. She had a lot of fever and cerebral malaria, and she was starting to to just go nuts, basically.
Like delusion.
Delusional, and so we rushed her to the hospital. She's alive today. And this didn't happen to everyone. Like, if we didn't have the means to just take her to the hospital fast, I don't know where she would be today. So the passion is around what I know has happened to people that I know, colleagues that have lost children to malaria. It's a very personal fight.
If I may interject, I've had malaria twice in Africa. It's an occupational hazard, and it's like, okay, we need to do something about this.
Yeah, wow. Okay, well, thank you for sharing that personal story. So Manuel, maybe we'll start with you. I know you've had a lot of experience sort of designing and implementing innovative mosquito and vector population management, whether it's the U.S. President's Malaria Initiative, working with a number of ministries of health throughout Latin America, and the Pan-African Mosquito Control Association. Could you speak to sort of the importance of and maybe some successes of integrated management?
Well, integrated mosquito control has been documented that works. If I can go back a number of years, in 1938, Fred Soper eradicated Anopheles gambia, what was thought to be Anopheles gambia, from an area in Brazil the size of Togo. And that mosquito never came back. And for those of you who are questioning the methods, and nature never got the hiccups for doing that. Years later, he did the same thing with Aedes aegypti in the continental mass of South America. And dengue and Aedes aegypti was declared eradicated from the continental mass of South America using integrated vector management at the time, what was with the tools that were available at the time. The United States and parts of the Caribbean, including Puerto Rico, where I'm from, eliminated malaria, I believe it was 1950-51, using environmental management and integrated vector management. So the tools are there. And the problem we have today is that even though many talk about IVM, integrated vector management, or integrated mosquito control, most of the tools that are in the mosquito control tool bag are collecting dust and getting rusty. And a handful of us, including my friend here, Silas, are in a position that, hey guys, we need to look at what we're doing. And the question is, are we doing the right thing, and are we doing things right? And I, for one, think that the answer to both of those questions is not quite. We can improve what we are doing to the point where we can repeat what was done in other countries in the past, meaning more than 30 or so years ago, so that malaria doesn't overwhelm, malaria and other mosquito-borne diseases, doesn't overwhelm the resources that are available to a country. And that said, no country has the resources, okay? Because mosquitoes show up and everybody's like, oh, what do I do now? Okay, the United States has West Nile. Occasionally, the United States has 1,000 or 2,000 cases of malaria, and nobody seems to know, because the mosquito control districts in the United States take care of that, and it doesn't become a problem. What we would like to see is that approach to integrated mosquito management is adopted, adapted, and adjusted to other countries.
Mm-hmm. Right, and there's active integrated mosquito management programs throughout the U.S. and
Right.
the Caribbean, right, to today. So can we talk a little bit about that scalability? Because I know that there have been, let's have frank conversation. I know when I've heard this come up, the concern has been that the cost is too expensive. So I'd love to sort of dive in. Is that a misnomer? Is that correct? Or I don't know. How would you approach that question around sort of the cost effectiveness of integrated mosquito management?
Yeah, thanks. So I think back in, it must be 2012 or 18. I don't have the year correctly, but there was a study that was done to answer exactly that question. So they were comparing larval source management, in this case larviciding, what's the cost? And everyone believed that it's going to be more expensive than the existing tools or interventions that were in place. What the study found was that, and it's published, that the cost of larviciding in this case, part of LSM, was between the cost of a net and a cost of IRS. So the idea that this is an intervention that is too expensive is not correct. The second thing that we've been discussing with other people, and that is also documented, investing in mosquito control, you shouldn't think about that more as a cost, but rather than an investment, because it's been demonstrated that every dollar spent on mosquito control, you have a return of $5 back. So you could actually see this as an investment rather than a cost. But also, I think since you're talking about costs, we need to think about the real impact of malaria itself, just as one disease, on the continent of Africa, losing up to $12 billion every year just of malaria. And countries that are losing like the GDP just because of the disease. So it's we shouldn't even think twice when we're talking about investing in mosquito control, because that will have an economic return in the countries. So countries with malaria are more poor than countries without, and that's not just a fluke. There's a cause. Malaria is a disease of poverty, and it's a circular thing. The more poor you are, the more likely you have malaria. The more you have malaria, the more poor you be. So it's an investment that we have to take seriously.
But if I may, there's another thing. I mean, if you do the numbers today, malaria claims somewhere around 600,000 people a year. Okay? Add to that other mosquito-borne diseases, dengue, West Nile, chikungunya, Zika, and the total number comes to about 725,000. And that's 725,000 people dying every year. That's equivalent to about 6 747s crashing every day. And if you turn it out in numbers that I can understand, that's 100 people every hour. We need to do something about it, okay? We had a plane crash in Indonesia about a year and a half or so ago, and they're still investigating. And here we have 5 crashing every day, and nobody seems to care.
Right, it is an emergency. And I mean, I had heard up to 1 million, right? Or
It was up to 1 million about 2 years ago, right?
Maybe it's, so, right. And that, and we know that mosquitoes are actually the most dangerous animal, the animal that kills the most people every single year.
And if you think a mosquito is insignificant, try sleeping with one buzzing on your ears.
Right, right, that's a good one. So it is an emergency. So why do we think, I mean, and I see you have some manuals that date back centuries, it looks like.
This is from last century. Yeah, this is from last century.
From the 1900s. So talk to me about, because the history here is fascinating, and I didn't know much about it. So integrated mosquito management was sort of a mainstay of, can you talk about the history and why was there sort of a move away from this strategy? Yeah, love to.
The global malaria eradication campaign way back in the 50s wiped out malaria from essentially 4 continents. They wiped it out from the United States, from Europe, from South America, but Africa was never touched, okay? And being semi-politically incorrect, as you said, a rebel rouser, those who think that or maintain that larval source management and larviciding doesn't quite work for malaria control, I would recommend you read this manual on larviciding for malaria control published by WHO in 1973, last century. There are some things in here that we cannot use today because we have better stuff. But this has been around for decades. And the other one, Manual on Environmental Management for Mosquito Control, with special emphasis on malaria programs. They've been around. We're not reinventing the wheel. We're just fine-tuning the spokes.
So, okay, so looking forward, how can we ensure that this is integrated, and I guess maybe touching to Silas on the importance of community engagement, because I know there is an emphasis, and we just had an event yesterday about the importance of investing in endemic communities and countries, and I think maybe one of the challenges has been we've gotten used to, and obviously there's been incredible commodities that have been very effective in terms of driving down cases and deaths over the last 15, 20 years. But maybe it's the concept, it's sort of harder to grasp, or it's less tangible in people's minds, but I know it's really actually investing in local communities and actually working in a really multi-sectoral way, right? It's not just the health sector, but it's the infrastructure, environmental sector. So could you talk about that kind of integration across sectors, and also how communities are engaged in the process of?
Yeah, so just for the sake of perhaps people who are listening, there are a few things that are easier to keep in mind. So when it comes to community involvement, there are like 3 E's. E, like letter E. Educate, empower, evaluate. So the community, first of all, needs to be educated. Just again, a personal example. 2008, I went to Ethiopia just for my work, and then arrived to a family. The family had within a meter, I don't know how yards work here in the US, but within a meter, they had a huge puddle of water, huge. So I asked the mom, she had her child in the hands, like, what do you do with this water? And she said, it's for my goats. When the goats come home, they have to drink here. This water was teeming with larval mosquitoes, like teeming. Like you do a deep of the water, it's like 200 larvae in the deeper. And I asked her, do you know what this is? And she's like, no, it's some insect in the water. She couldn't make a connection between the water in front of her house and malaria that her children have every year. So there's a level of education that we have to have in the community, but also we have to empower them. So once they know, what do? Africa is the youngest continent today. We have a lot of young people who are jobless, who need something to do. So imagine all that workforce, you train them, they know what to do in terms of mosquito control, and you give them the tools, you'll go a long, long, long way. And then finally, you have to evaluate. You have to see if your method works. You have to change where you have to change. So I really wanted to emphasize this thing on community, because these days we're talking about localization. We're talking about empowering Africa to do or to find solutions for their own problems. And this is an opportunity to do that. Educate, empower, evaluate.
So.
One more thing in the education one. In my bouncing around Africa, contrary, and I hate to compare, but contrary to the United States, mosquito control districts in the United States are done essentially by communities, by counties. They don't go to the president asking for permission. In Africa, and most of the continent, in the continental mass of South America, the minister or the person, a mid-level manager in the field, has to go to the minister for permission. Very few countries have the equivalent of a mosquito control district in the United States that can make decisions on the go, in the field, and adjust the plan to make sure that that plan is implemented. In many, many countries, the field managers and the field operators have to go 2 levels up and wait for the minister to make a decision, and that may take 3 or 4 weeks, and that is unacceptable. 3 or 4 weeks, a whole village can be dead with malaria or West Nile or dengue or whatever.
Right, and so the importance of decentralization to the point of making it, and I mean, I now I've been in this position for about 12 years, and I do feel like even over that short time, there has been an evolution of thinking of moving from a one-size-fits-all approach, right, just national bed net campaigns, to recognizing that you really need to have tailor-made, locally driven strategies. Now, whether or not we've made that full transition, no, and of course, cost, is an issue. So I guess I'd love to hear a little bit about, well, 2 things, the scalability piece, but then also what you said about the job creation I think is so fascinating. So we've been involved working with PAHO and the Malaria Champions in the Americas annual award. And every country that's eliminated malaria in Latin American context, all of the content that they share, a lot of it is outdoor mosquito control and integrated management, and the pride that people have for being a part of that elimination effort within their community and their country is palpable. It's beautiful. I mean, so to talk about like giving people dignity and purpose and jobs and being a part of something bigger than themselves. So, but so how would it work? I mean, so it has been worked a lot in the Latin American context. Is it scalable? Africa, Nigeria, and we'll look forward to hearing what Dr. Ntadom says, but is it scalable? Is it feasible? Or what would be needed to scale it in the way that it would need to?
It's scalable. So usually I get puzzled by questions that people have about let's say malaria control, mosquito control in Africa, because Africa is big and because Africa is poor, and there are many things that people say. But we're talking about mosquito because they are biting people. So it means wherever those mosquitoes are, there are people who are there who can do something. So it's not like we have to fly people into the jungle and they have to find out what to do. They are there, they are being bitten by mosquitoes, and as I said, educate them, empower them, they will know what to do. It's not rocket science. You don't have to have a PhD to be able to control a mosquito. You don't have to be specialized in anything as soon as you know that this puddle of water, to go back to my example, this puddle of water is what is causing me a problem. You will just do that, and then you just control what you see. And there's a lot of people, for those who have been in Africa, and we have that in the news. Oh, we have a lot of people, they don't have what to do, there are no jobs, and we don't know how to create jobs. That's a job right there. And something you talked about dignity. The mistake most people make, particularly in the West, forgive me to say that, is to think that poor people don't know what to do. It's not true. It's just I don't know why people think that way. People know what to do. Maybe they can't do it, they don't have the means, but they perfectly know what to do. I'll just give you an example, and then maybe I'm straying outside the subject. We had some people come to explain how nets should be used and how nets should be hung. In Africa, they had flown from the US at the time. And one of my friends told them, or gave them an example, these rural villages that have a lot of malaria, do you know how people build the house? There's no Westerner coming to build the house for them. They know how to build a house from grass, from thatch, and they make a house that doesn't leak during the rain, and they live there. So how do you imagine that these people can't understand how to use a net, for example? It's just, it's something that we need to get out of our minds. People know what to do. Maybe they need to be educated more about this and that, but there's enough that can be done in Africa. Scaling will be easy. We just have to change the way we think, the way we approach it.
And it is not either or. This is not, again, I need to emphasize, this is not an either or. And the scalability, we have been spending roughly $2 billion US for the last 15 to 20 years on malaria control, and we still have 6, 747s crashing every day. The money is there. As you pointed out before this conversation, we need to reallocate some of that money to make sure that some, or whatever piece of that puzzle fits in whatever community gets implemented.
And is this so obviously there's big donors like the Global Fund or PMI, but there's also ministries of health.
Local.
I mean, domestic resources need to be further mobilized. So I mean, what can be done in terms of that endemic countries themselves are investing, because this is infrastructure and this is obviously the health of their people. So do you find our ministries of health in many endemic countries, are they taking this on? Are they working in conjunction with the environmental ministry, public, infrastructure?
Yeah, so that's when I can turn back to our governments, my governments, back home. They are not doing enough. There's no shying away from that. If you look at the budget for health compared to every other thing, it's usually the smallest budget in the country. So that definitely needs to change. But there's more that gets into the finances and how countries manage the funds. If you have 10 problems and then someone comes and tells you, I'll resolve problem 9, you'll just focus on the other things. So the donors are doing very well in supporting the countries, but they have to force the countries, endemic countries, to also raise their funds. We can't just rely on the West pouring in money when we can put in our own. I mean, it's not that Africa is so poor that it can't manage their own problem health. It's an issue of priority. It's an issue of allocation, as my friend just said.
Yeah.
And if you want to implement something, and I'm sure we both come across this, if you want to implement something in a village that is 100 miles from the capital city, and you have all of the tools, you have all the trucks, you have all of the materials and everything, but it takes you 4 days to get to that village, you know, things are going to fall apart. Starting with the infrastructure, you start getting the roads better and access better and the potable water better, but invariably is like, no, I don't have money for roads because this is malaria.
Yeah.
No, it's all connected.
Well, I'm glad, and both of you have sort of touched on the hard-to-reach populations, the last mile, whatever you want to call it, rural. So, can we talk a little bit about that? Like how? Because I know at Beat Malaria we particularly focus a lot of efforts on inclusion of refugees and displaced people, and I know that's a personal priority for you, Silas. But also people who are living, you know, in remote areas that don't have access to health clinics. So, can you talk about the role of this approach to ensure inclusion of all people, because ultimately, right, if we are to eliminate, everyone needs to be included.
Yeah, I think integrated vector management, mosquito management, outdoor mosquito control actually draws in everyone. You can do a good mosquito control being in a refugee camp. You don't have to be a special person. We're actually doing that in a refugee camp in Mahama in Rwanda. So it's possible to involve everyone, women, children, everyone can participate. And that actually gives people dignity. I mean, there is a sense of dignity you get from having done your own thing without someone having to give you something. So there's a sense of dignity, and that exists everywhere. It's here, it's in the poor people, it's in the rich people. Everyone seeks to have a dignified life. And this is an opportunity. I mean, it's an intervention that elevates everyone. There's a sense of community and doing something for the community. You're controlling mosquitoes here, they will not bite your neighbor. There's a lot that can be tapped into getting people ready and to intervene. And they are capable.
And talking about refugees and emergency management, spend 2 minutes in emergency management. An extreme example was Hurricane Laura in Louisiana just a few years back. The mosquito population resulting from the massive flooding of Hurricane Laura caused the death of around 700 animals, including about 400 cows and about 200 horses and another 200 or 300 pigs and Lord knows how many birds, all from exsanguination from mosquitoes, okay? These animals didn't have enough blood to stay alive. Now you imagine you put a hurricane in Southern Africa that wipes out, that has no resources or very few resources, and now all of a sudden there's no indoors to protect the population because we're using indoor methods. Now there is no indoors to protect the population from the massive amounts of mosquitoes that are being generated by these disasters. And what do you have? A massive catastrophe.
Right, wow. Well, and thank you for bringing up, obviously, the impact of extreme climate events and increased temperatures and different rainfalls. Of course, we know that's a whole topic in and of itself. I know we're going to soon turn to Dr. Godwin Ntadom. So maybe just quickly to end, are you hopeful? I know you're both frustrated that this strategy has not been better incorporated So are you hopeful, or what, and why? Or are you not? And it's okay if you're not, but sort of what do you think needs to happen? And are you hopeful that there's an opportunity looking forward?
Yeah, so as long as I'm alive, I mean, from where I come from, I have to be hopeful. So
Yeah.
I am hopeful because I'm alive. But there's a lot that we can do. And I'm also hopeful that we're actually having this conversation
Exactly.
today. It's been, I mean, my friend knows, 15 years we banging on this and it's not happening. So I'm hopeful that we're having this conversation. Just three things to take away for me before we finish. Let's localize this initiative. Let the Africans, the Asians, whoever is concerned, take lead in implementing these things. We have a huge reliance on commodities. We need to switch that. We need programs rather than campaigns. People have to be serious about this, being in the long run, so that maybe I don't have to sit here again 10 years to come talking about the same things. But I'm hopeful. Since we are live and we are talking, maybe something will come out.
There you go.
This conversation is making the tunnel a little shorter. And this conversation also starts with the change of looking at this not as an expense, but as an investment. But we need to have more of this conversation. And
Absolutely.
I am hopeful.
Yeah, well, my hope is that because we're in a precarious situation, I do think that partners, donors, communities, leaders are thinking about things differently. And I truly hope, and I am an eternal optimist, that we can really get strategic and smart about how can we learn from the past, but also learn how to do things differently, and so that we can truly create a malaria-free world. So
Anything we can do before we cannot do it anymore,
yeah, exactly.
please let us know.
Excellent. Well, thank you. So I think we're going to now hear from Dr. Godwin Ntadom. So I think he has some remarks we're going to hear from.
Hi, my name is Godwin Ntadom. I'm the national coordinator for the malaria program in Nigeria. Nigeria bears the biggest burden of malaria globally. Malaria in Nigeria is about 30% of the global, or 31%, as recorded by World Malaria Reports in 2023, and about 27 cases of all global cases occur in Nigeria. The challenge with Nigeria is that the entire country is endemic for malaria. Everybody in Nigeria is at risk of the infection. And this has been for several years. The disease that kills most in Nigeria is malaria, responsible for about 30% of childhood mortality. The country itself, supported by partners and agencies, have been doing a lot, but unfortunately, with all this, we've really not achieved so much. In May 3rd, 2024, early this year, the coordinating minister, after coming in as the Minister for Health, studying the challenges of malaria in Nigeria, decided to organize a meeting which was termed the Rethinking Malaria in Nigeria. And the whole idea is that why is Nigeria responsible for the greatest burden of malaria globally? Nigeria is not the most populated country in the world. And why are we sharing more than 30% of the disease burden? What are we, or have we been doing that are not working? What are those things that we need to do that we've not been doing? Then technically, we have to sit down, reviewing the past efforts of malaria control in Nigeria. It must interest you that malaria program in Nigeria is one of the oldest programs in the country. And imagine also that we've been fighting the battle of malaria since 1948, yet we contribute the highest burden globally. And if you look back history, Some of the biggest research work that have been done on malaria were done in Nigeria. The Garki project work was done in Nigeria. And one of the things we did as a program after the rethinking malaria is to look back at the efforts that have been carried out. What were those things? If you think of mass drug administration, we've done it in the past. If you think of the use of sulfaline, pyrimethamine, we've used that in the past. We've been using nets since 2010. Programmatically, we've been doing campaigns since 2010. What that means is that for 14 years, Nigeria has been carrying out campaign net use, yet we've not been able to achieve great results. What would be the challenge? We now went to study the epidemiology of the vectors. You have to look at the human angle and the vector angle. One thing we picked from the human angle is their behavioral pattern. People have really not been using some of the deployed interventions. Of course, there are a limit to which you can push people to use your interventions. One thing we have is a major challenge with the use of nets. The use ranges from 13% in a place like Lagos State. That means you distribute net only 13% of the population, and we have a national average of 34%. Of course, with that low usage, we cannot achieve elimination. Another thing we also consider is that the types of mosquito we have in Nigeria, which are the Anopheles gambiae complex, they have an attitude. They are highly anthropophilic. That means they will always want to bite human. Another nature is that they are exophagic. That means they want to feed outside, and they are also exophilic. Many of them, you can put it 50-50. It ranges from 50 to 60 to 70% in some parts of the country. And if you consider what we've been doing in the past, our focus has always been indoor. If you talk of IRS, it's indoor residual stream. If you talk about the use of net, it's indoor. And we also know that our people stay long outside. So if you only attack the vectors that come into the house, what about the ones that are outside? That's an area we now looked at critically, and we felt if you go down to the Sudan savannah in the northern part of the country that covers almost 19 states, we have not deployed any outdoor intervention. Coupled with the fact that when you go to this environment, almost all the entire 19 states grow rice. Kebbi is one of the largest rice grower in Africa, I must tell you, producing tons and tons of rice every year. And not only that, they do farming throughout the year because of the availability of irrigation. So it's not that they do it during the rainy season. No. The government and the federal government have done it in such a way that water is always available. And when you now go to this environment, the vector density is higher than what you can ever think of. In the Garki project, it was put that the level of transmission in the Garki area was 2,000 times higher than what is expected to maintain transmission or to sustain transmission. And if you continue to focus indoor, what it means is that you can never achieve any results. And that is why we are now doing a rethinking in the language of the coordinating minister to begin to look at interventions we can deploy outside the living apartments. If we're able to reduce significantly the population of the vectors, definitely we have less mosquitoes coming into our living apartment. And that will be very good for us. And that is why we have chosen to deploy, which is actually the cheapest of all the intervention outdoors, larval source management, focusing on these major areas where we grow rice, irrigation sites, some puddles and ponds that are perennial. If we're able to do this, we are sure that we are going to drastically reduce the population of vectors. While doing that, we are not also neglecting the use of nets. We are not also neglecting areas that will benefit from IRS. So this is going to be a package. And hopefully, deploying all these interventions, we believe we are going to eliminate malaria in Nigeria. Okay, sometimes when you think of some of these interventions, people talk about the cost. Oh, it's expensive. And one of the challenges we had with the Gariki projects was that while these interventions were being deployed, the community people were actually spectators, in the sense that they were not, involved. Our deploying this intervention, which is going to be the larval source management, we want to build in the community participation from onset. It's going to be a sustained intervention. So it is better we carry along the community people, teach them how to do it. We don't need any complex measures. But of course, when you think about the rice growing environment, the rice paddies, we are careful about not to destroy those rice seedlings and other while the farming is going on, because of course that may lead to rejection. So we are thinking of incorporating new technologies like use of drones, if we are able to acquire, and many other things. But practically, we want to create that awareness in all the communities that it is their intervention. It is safe. You can leave it in the hand of the community people. They can do it on their own. So our own is to build the capacity of the officers in the village. Not only the community people, but youth clubs within the communities. And once they have incorporated it as an intervention, honestly, even when you don't go, they will demand for it. Those are some of the things we are looking out for to create stronger awareness, sensitize the community, carry them along as we are doing all these processes. Thank you.
So the question is, besides eliminating standing water, what other outdoor interventions are recommended for outdoor mosquito control? Which one of you would like to answer?
Yeah, I can go quickly, because there's one thing that we don't talk about in Africa, which is space spraying. Like spraying outdoors against adult mosquitoes in this case. So attacking mosquitoes outside, so there's attacking them when they are in the water. So what they are saying in Ethiopia about removing water bodies that you can remove, but some of them you can't, so that's why you do larviciding. But you can also attack adult mosquitoes by spraying insecticides outside, so that mosquitoes that are flying get the insecticide and die. So that's another intervention that you can use, that we don't use in Africa, but we should be using.
Ah, okay, interesting.
And chemical barriers and spray sprays and repellents. There are chemical barriers that you can put on some vegetation to keep the mosquitoes away from the population and from animals. You can move animals away from houses, so the mosquitoes are attracted to the animals and not necessarily to the humans. There's all kinds of things we can use.
Yeah. So quickly, why isn't outdoor spraying used in Africa?
Oh,
is there a particular reason?
Space spraying.
You said space spraying.
It's a misconception, first of all, that is there. And just to give you a quick answer that we got last year from a 40 years experienced professor who was answering this question. He said, if you have people dying in your community every night, then you can consider space spraying. And I'm like, we actually do have
Yeah.
people dying in the community every night. So there's not that sense of emergency. Usually spray spraying is used in epidemics when there are emergencies, but we do have an epidemic and an emergency going on every day in Africa. So it should be used.
Okay, yeah, absolutely. Okay. Another question from Isa in Burkina Faso. So why are repellents not recommended as mass strategies given the long external exposure to mosquito bites? So I think personal or spatial repellents.
Then there are two types of repellents. There's the topical repellents that you put on yourself, and the chemical barriers or repellents you apply on vegetation or structures. The problem with the topical repellents for persons is that just like sunscreen, you have to reapply every 2 or 3 hours. And if you are in the tropics, anywhere in the tropics, and you sweat profusely because it is hot, that sweat is gonna remove some of that repellent, so you need to reapply a little more often. And the chemical barriers, the structural repellents, are not considered by many of the people who actually handle the funding as an appropriate tool. So that
Yeah, but just to mention, there's special repellents that are coming up right now. There are trials that have shown very good results in Kenya and elsewhere. So it's under WHO consideration for recommendation. So it will come up soon, I think.
Okay. Another question. So we talk about there's a strong track record maybe in rural areas where mosquito habitats are more fixed and findable. But how does that strategy sort of change with urban vectors like Stephen Sy, where larval sources are in backyards, gutters, other hard to find areas?
Yeah, I mean, there are many solutions. As soon as people start thinking that this is a strategy they want to do, there's walls application of the insecticide. So you spray, the droplets of the insecticide will travel and find actually the water bodies where they are. That's a very good intervention for urban mosquito control. And then you can also do traditional larval source management, can also work in urban areas. You can remove the sources in urban areas. That's actually what we mean. Because of Stephen Sy, because of outdoor mosquito biting, that's actually why you have to think about outdoor mosquito control. It's very feasible, it's happening in other countries, and it's working perfectly.
Okay.
And you don't have to spray the whole continent. It's been studied that all you have to do is go 100 meters from a source, from a house or a village, to do that larviciding, spraying, and whatever, to be able to manage decent control.
Yeah, okay. So one more question, then we're going to wrap up here. And thanks again for everyone joining us. So question from Sweden. For countries that adopt sustainable solutions like larvicides and outdoor mosquito control, how long would it take to eliminate malaria from these countries? Of course, it's variable depending on the country. But maybe is it possible? And are there examples of when, this has been used to help eliminate?
Yeah, I mean, Manuel said it before. Where we're sitting right now in New York, America had mosquitoes, malaria before, Europe had malaria before, Israel had malaria before. It's possible. So we should go from knowing that it's possible, but avoid putting in a date. I don't know when, but let's put hands in and boots on the ground, and then it will happen.
But once you define the date, you say, let's say next year at June 15 of 25, there are no mosquitoes in wherever. Don't shut the programs off. Because that's what happened, exactly what happened in South America. Aedes aegypti got wiped out from the continental mass of South America, and everybody went, woohoo, this is great. We don't need you anymore, and they shut them off, and dengue came back.
Right, and we certainly, that would be such a shame. And it is exciting that we are. I think 44 countries have been declared malaria-free that had been endemic before over the last few years. Cabo Verde this year. I think we anticipate that Egypt will be. So there's a lot of momentum going forward.
Right.
So want to thank everyone. This has been a fascinating conversation. I think to recap, to me, I think it's, as we're really trying to eliminate, that is our goal. We want to achieve a malaria-free world. It seems like whether it's donors like Global Fund and PMI or endemic countries and communities really need to reconsider and reevaluate how to have integrated mosquito control as part of their programs. it seems like rather than viewing it only as a cost, and maybe that needs to be further evaluated, it's an investment. It's a way of investing in local communities, job creation, and having a tailored approach that can reach all people. So really appreciate, and I think it's like if we're serious about doing this, we have to be willing to reconsider and do things differently and more smartly. So thank you so much to both of you for joining today, and thank you, Dr. Godwin Ntadom, for joining from Nigeria and sharing your experience. So more to come. Thanks, everyone.
Thank you.